The role play will last for about 5 minutes. Don't worry if I stop you when the time is up. Can you start the role play, please?
Okay. Hi, Jane. I'm Dr. Spark. How are you feeling?
Hi, doctor. Not great. I want to know what's wrong with me. This has been very difficult.
Of course. I know that my colleague, Dr. Ryan, has examined you and that you had a scan and a few tests done. I'm here to discuss the results with you and what we can do to alleviate the symptoms you're experiencing. All right?
Sure.
First, I'd like to confirm some of the details you shared with the doctor earlier. Can you tell me what bothers you the most?
It's the constant dizziness.
I see. And you had it for how long now?
About 3 months.
Right. I'm wondering if you remember how it started. Was there a health problem that happened right before the dizziness set in?
Yes, actually. I had an inner ear infection, and that's when I first felt dizzy. The infection went away, but the dizziness has been getting worse.
Have you noticed if it's worse in certain positions or situations during the day?
It's worse when I stand up or move around.
That must be making you feel very unstable.
It does, yes.
I see.
I feel really nauseous too, and it gives me headaches and neck pain.
Okay, so you've been experiencing dizziness, nausea, headaches, and neck pain for about 3 months now, following an ear infection. No doubt this has had a major impact on your daily life. Can you tell me a bit more about that?
I haven't been able to go to work or do housework. Some days I find it hard to get out of bed or leave the house. I'm in constant pain and I have this anxiety.
I certainly understand how badly you've been affected by these symptoms. You mentioned anxiety. Can you tell me a bit more about what worries you?
Well, something must be seriously wrong with me. All these symptoms, they must have something to do with my brain. I'm really worried I might have a brain tumor.
We definitely checked for that. That's what the CT scan was for, and it came back clear. There's no evidence of anything physically wrong that might be causing your symptoms. That's good news, isn't it?
Are you absolutely sure?
Yes, the scan result was definitive, and the comprehensive blood tests didn't show any problems either.
Then what's causing all of this?
Based on your symptoms and test results, we suspect a condition called persistent postural perceptual dizziness. It's sometimes referred to as PPPD or 3PD. Have you heard of it?
No. What is it?
It's a type of sensory disorder that's known for causing chronic dizziness. It can be triggered by an episode, a dizzy spell, which is perhaps what happened when you first had the ear infection. Does that make sense?
But the ear infection cleared months ago. Why am I still plagued by this dizziness and nausea?
Well, first comes the original episode of dizziness. Then the brain, in certain circumstances, becomes hypersensitive to the dizziness. This leads to the brain noticing the sensation more and more, which in turn makes the feeling stronger. Do you know what I mean?
So you're saying it's a kind of trick my brain is playing on me, only it's getting worse, which is really disturbing. What can be done?
I'm going to refer you to a neurologist for assessment and diagnosis. This will be our next step, all right?
Look, what you're saying about the sensory disorder, I just don't think that's right. There's something seriously physically wrong with me, not mentally.
I understand that this may be hard to take in and that you're suffering from very real physical symptoms, but the brain is very complex. The tests you have today show no physical concerns, and this is very reassuring. But we need to investigate further, which is what the neurologist will do to decide on the correct treatment. Does this sound like a reasonable plan?
What sort of treatment are we talking about?
It might be a combination of medication and certain techniques, such as vestibular rehabilitation. Psychotherapy may also be helpful.
I really don't need psychotherapy. This is not some mental disorder.
That will be up to you, of course. The important thing is to start with proper neurological assessment to find you the most effective approach. All right?
Okay, I'll see the neurologist.
Excellent. Do you have any more questions?
Thank you. That's the end of the role play. If you would like to participate in your very own OET speaking mock test with an E2 examiner and receive feedback for your upcoming OET test, sign up for an OET test preparation package at e2testprep.com. Thanks for watching.